Well, good evening, everyone. My name is, I think most of you will know, as Campbell McKnight, and I'm the chair of the board of the ANU Chaplaincy. So I welcome you to this evening's event. And let us begin by acknowledging that we meet on land which has been cared for since time beyond memory by Aboriginal people, and particularly in this case by the ancestors of the Ngambri and Ngunnawal people, and this care continues. And we're grateful that we can share in this care. With the ANU Chaplaincy, we are graciously hosted by Burgmann College this evening, but both institutions strive to provide safe places for all people, irrespective of background, language, gender, or sexuality. And may we all observe and rejoice in such openness. It's my great pleasure this evening to introduce Professor Tracy Smart, who's going to talk to us about caring for each other in a time of pandemic. And if it were daylight, I'd refer you to the window up there, which talks about a tenderness for each of our moments, and for the world and for each other, I think. But caring for each other in a time of pandemic. Now, the ANU Chaplaincy tries to do two main things within the context of the ANU. Firstly, our team of multi-faith chaplains can, in certain circumstances, walk with members of the university community, the whole university community, who have some issue with which we can help. If they're sick or need psychological help, we refer them on as appropriate, of course. But healthy people too can need help, and we can sometimes provide it. Secondly, we strive to provide some space within a sometimes challenging environment to discuss religious issues and the spiritual dimension of life. It's not our job to convert anyone, and indeed our policies specifically prohibit such activity. Indeed, given the variety of faith communities represented among our chaplains, we just recruited another Buddhist chaplain recently, any such conversation would quickly get rather complicated. We can, however, support and encourage the various faith-based clubs and societies registered with the ANU Student Association. We can do a bit of that in the space given to us. The other thing we can do is to hold this annual event with speakers to raise ideas and provoke discussion that might not otherwise be heard. Last year, of course, this was not possible. But tonight, we are very privileged to have with us Professor Smart to talk on such a topical subject, and one which is very relevant to the chaplaincy. Now, Professor Smart is a South Australian, a doctor, a retired and very senior officer in the Australian Defence Forces, particularly the Air Force, and now, with a long list of academic qualifications behind her, she is discovering how universities, or at least the ANU, work from the inside. Interesting difference. So, as well as being Professor of Military and Aerospace Medicine in the ANU Medical School, she's also Public Health Lead of the COVID Response Office for the university. Go over that. The Public Health Lead of the COVID Response Office. Now, these are unprecedented times. That was last year's word, but I think I can use it this year. These are unprecedented times, but we do have someone to speak with us this evening who is fairly unprecedented. And we look forward very much, Tracy, to hearing what you have to tell us. So thank you.
Hi everybody, and thanks very much for the introduction and for inviting me. If I knew the food was this good, I would have come before. Make sure we've got the slides working. Do it that way. Okay. So yes, it was a great privilege to be here, and I was given this very broad topic to talk about caring in the time of a pandemic, and I think it is really actually a very good topic to talk about. We get very involved. We all know now, you know, we all think we're amateur epidemiologists. We know what an R0 value is. We debate the, you know, the difference between Pfizer and AstraZeneca and everything else. Proud AstraZeneca taker myself. But we don't really talk a lot as much about the mental health and the caring aspects of the pandemic. And so what I'm going to talk about tonight, and those of you who've been in the military know you have to have a scope, you have to remind yourself what you're going to say at the start. First of all, a little bit about pandemic preparedness, why we weren't ready, why we're saying this is unprecedented even though it's happened before, for instance. Then what are the mental health effects of the pandemic? How has it affected people's mental health? Then a bit of an exploration of what I call the upstream, tackling the upstream. And I think that's the business that the chaplains are in the most, is the wellness side of things, the wellbeing side of things. How do we actually take a positive look and empower people and learn the lessons of the pandemic to actually help people become stronger and grow? And then, and to illustrate this, I'm going to talk a little bit about my own lived experience and how I became resilient, and also experienced what people are coming to call post-traumatic growth, and a little bit about that, and then some sort of, I guess, general thoughts on caring for ourselves and others. So first of all, COVID-19. Why were we all so surprised? We've been having warning signals about this for a long time. We all now know of the Spanish influenza pandemic of just after World War I. Most of us in this room probably knew of it before. A lot of people had never heard of it, but that was a good warning of what these sort of infectious disease could do. But we've had warning shots since then. We've had things like the Hong Kong flu. Many of you would have heard in the 60s, SARS, or SARS-1, because of course this virus is SARS-2, swine flu, and also the Middle East respiratory syndrome coronavirus. So we knew that these diseases happen, and we knew that they would come along. And in fact, I was speaking to an Air Force colleague just when we had our Air Force anniversary, 100th anniversary this year, and he said, I remember talking to you just before you left the role as Surgeon General, and we were talking about security threats coming up, and I said, don't forget the next pandemic's on its way. So this was not a surprise to many of us. But I think some of the reasons why we didn't get it is that more of us expected the zombie apocalypse. More of us had actually sort of watched The Walking Dead, maybe not in this room, but sorry. Yep. Oh. Sorry, just enter or. So anyway, I think maybe not in this room, but more people had actually watched things like The Walking Dead and had thought, now, what do I do in the zombie apocalypse? What am I going to do? How am I going to save myself? Whereas they should have been watching something, oops, sorry, I lost my thing, like that, like Contagion. Contagion's a great movie to watch at the start of a pandemic. Well, if you're like me, you learn all about the epidemiology that R0, but what you do know in that particular virus was much more deadly. So that's the movie we should have been watching, but I don't think there was anything that prepared us for what the first effects of the pandemic were, the great toilet paper rush. And of course, even when we were, you know, had to wear masks, or even actually when the Sydney outbreak was just starting this time, friends said they went to Coles or Woolies and there was no toilet paper. That's the first thing people take. I just cannot understand it. But maybe it's because we shop at Costco, so we had about 2 tons of toilet paper already in the garage from the last shop. But so people weren't expecting it at all. But Australia's health system was prepared, and that's why we've actually done quite well. We've got a really good health system here. We've got a network of GPs. We've got a health system up to hospital level. We've got a chief health officer who runs something called the Australian Health Protection Principles Committee. It was Brendan Murphy, and now of course it's Paul Kelly. That was something I sat on as Surgeon General. We had all the chief health officers from all around Australia. We did desktop exercises and things like this. So we were very well prepared. We had a national medical stockpile. We had experts. So we were able to cope with the early days of the pandemic really well. But the problem is that the average person had no idea this was coming, and it really took them by surprise. They had forgotten history or never known it. And I think that people don't perhaps spend a lot of time thinking about their health, particularly when they're younger. And it's not necessarily always a priority, especially public health, sometimes in funding of governments. There's also, I think, a perception that Western medicine is a bit invincible. You know, we don't see much infectious diseases in Western countries. We think there's a pill or a jab, you can have a flu shot or this shot or whatever else. We don't live with it now like we did even when we were younger. You know, when you saw, you know, when I got measles and chickenpox and everything else, we've got, you know, solutions for those now. And I think that's what came as a shock. Can't we just fix this? And we also focus a lot on tertiary healthcare and the hospital level healthcare, and perhaps not as much on prevention, etc. And we also focus more on non-infectious diseases, the disease of Western society, like heart attacks and strokes and things like that, rather than infectious disease. I also think that we've all forgotten what our mothers told us about washing your hands and not spreading your germs everywhere you go. And even little things like, I know I had this concept, like the ad, that you have to soldier on with a cold. You go into work and you spread it to everybody, but because you have to, that's what you need to do. So we just forgot all these lessons that are basic hygiene 101 and that our mothers probably told us. And I also think, and I saw this in defence sometimes, there's a lack of individual responsibility for our own health, lack of understanding that being in good health is not just going to a doctor every now and then and being given pills. It's actually about taking care of yourself and looking after yourself as well. So the consequences of that, of course, have been quite significant. We've had people in denial initially, you know, that this doesn't exist. There's still some of them out. We saw them on the streets of Sydney just a couple of weeks ago. We had people thinking, well, it's just the flu. It will only last a few weeks. Couldn't possibly go on another until the end of the year. We even had people like in America, they've been talking about, you know, all the restrictions being lifted this summer and the pandemic's over. And now we're seeing the Delta strain is meaning that the cases are going up. There are nearly 100,000 new cases a day again in America, despite having about a 60% vaccination rate. And we also thought that, you know, I remember saying early on in the pandemic, you know, we haven't actually developed a vaccine in less than a few years for any disease. But we got these miracle vaccines within a year. But it's like, oh, well, it's over. The job's over. But of course, we know that it takes much more than just manufacturing, producing a vaccine to actually getting on top of things. We also had difficulties, I think, moving, and I was speaking to someone before about this, from what I think has become really a very individualistic focus in modern world, in the Western world in particular. I don't think, this is very different, I think, to other parts of the world, who still have the community focus that I had growing up, particularly in a small country town, that you looked after your community, you put their needs alongside of yours, and you knew that if something happened, there was someone there to pick you up. But I think we've sort of followed down the path of the dreaded the USA in terms of becoming much more individualistic. And that became then an understanding, well, I don't want to lock down, I don't want to be compliant, because that affects my life. Not thinking that you're doing that not for you, but for everybody else, wearing masks, all these sort of things. And then, of course, we had the lockdowns, and we continue to have the lockdowns. And that, you know, I think one of the biggest problems in our society at the moment, let alone this pandemic, is we do seem to be having a pandemic of mental health problems. And a lot of that is about losing that sense of community and losing that social connectedness. There are a lot of very lonely people in the world, and the lockdowns just exacerbated that. It hasn't been helped by confusion and misinformation. Of course, this pandemic means that things are changing all the time, and the Delta variant that's come along has really been the game changer. So stuff that was made sense earlier in the year doesn't make sense with the Delta variant. But that's been exacerbated by the media, spreading misinformation, sort of, pillaring the AstraZeneca vaccine, which is a very good vaccine, as I said, I had it. But, we haven't had clear communications from government. And also, of course, even in New South Wales, they admitted, oh, we didn't really think about translating this information to, some of the more vulnerable groups in Australia as well. And of course, it's been a cause of much disruption. And I think, some of you will be familiar with this concept of the social determinants of health, which says that health has to be thought of in the broader context. To really be healthy and happy, you need to have all of these areas of your life in order. And all of these areas of your life, depending, and some people had different effects than others, these were all disrupted. So this obviously it became an impact for a lot of people. And a lot of people felt we're going through a whole myriad of problems. And I know I missed things like substance abuse disorder and a whole heap of other things here, but it manifested itself in a lot of different ways to a lot of different people. Some, actual mental health conditions like anxiety and depression, but also grief, which I'll touch on in a little bit, exacerbation of mental health issues, problems studying, problems with financial, all of these sort of things. And I think now we talk about this a lot at the executive level at ANU, pandemic fatigue as well. Everybody just feels exhausted, burnt out. And some of the data, this is from last year, about a year ago last year, you can see in a survey of Australians that even those people in the middle piece here who had no prior mental health diagnosis, a significant amount of them, over 70%, if my maths is right, actually said that they had worse mental health since the outbreak. And that's much more so than people who had mental health, but everybody's mental health was affected. I must say mine was actually down the lower end. I find I don't like to say this all the time, but I found this an amazing and like a fascinating time to be alive, and having a job where you've got the enemy there, maybe it's the military background, got the enemy there, you're trying to find ways to defeat it and everything else, has actually been a very interesting time in my life. But for most people, it has been difficult. And I think, what we need to bear in mind, we kind of have this black and white view of you've either got a mental health illness or you haven't. And it's not like that. Mental health is, everything on the continuum. Hopefully most of us are generally thriving, at least in good times. But I think what has happened, and some are in crisis obviously before that, but what has happened is the pandemic's pushed that down for everybody. It's actually meant that more of us are in the surviving or struggling area, which makes us not only, less happy and everything's more difficult to do, but it also puts us one step away from being in crisis at times. So the burden we're seeing is not just people who have mental health illness, it's that everybody's mental health has been affected in various ways. And it does mean that we might not all need to go and see a psychiatrist, but it does mean we need to see the pastoral care and the voice and the discussions with people to be able to get us out of that. And I think that's probably one of the most important effects. And the other thing, and I wrote a blog about this, I think part of what some people are going through is grief. And it's a grief of, it's a loss of things. It's a loss of the normal life, loss of your expectations of what life is like, loss of social connection and all of these sort of things. And I think for some of our students too, a loss of their perceived future maybe. The world doesn't look quite like, there's a threat out there they never knew before. That all they thought about could be taken away just by this little invisible enemy called a virus. And we all are familiar with Kubler-Ross's stages of grief, and it all looks very neat and everything else. But we know that grief can actually have a very difficult path. And I actually don't think that, and again, I'm in the health profession, I don't think we spend enough time in the health profession understanding grief. And grief is not necessarily a mental illness, but it can affect your mental health. And I think that's an area, again, where chaplains really have a big role to play. And I know this just from observing people, but also a very good friend of mine lost a husband several years ago. Her husband, not any husband, her husband. And, she sort of confessed to me that she was actually still having problems. And yet all her other friends said, oh, you should be over it by now. Not understanding that hers was a complex path, and it was actually up and down, and she coped very well. And the whole aim was to get her kids through school. And once they got through school, it was the loss of the future that she thought she would have with her husband that was really causing her to grieve and not move on. So I think that this is a really important part of what people are feeling that is affecting their mental health. So what do we do about it? What does this mean? Well, one thing, as I said earlier on, was that we do focus a lot on the mental illness side of things. We sort of look at, when the government looks at what mental health services are required, they're looking at psychologists and psychiatrists and hospitals and all of this sort of stuff. But really what we need right now, I think, more than ever, particularly for those people whose mental health is suffering but they don't have a mental illness, is to focus on what we called in defence the upstream. And this model is called the step care model of care. The more you can do in the upstream to build people's resilience, to educate them, to help them understand what mental health looks like and how they can manage themselves, and indeed when they can actually then ask for help, the better off we'll be. And I think that this upstream, this self-management, this early intervention stuff is where we need to put a lot more focus. And I see, chaplains having a really key role to play in this. So what does the upstream look like? It means actually helping to empower people to take responsibility, to not passively sit by and say my mental health is suffering, but to be able to proactively engage and work on their mental health. And this is just a thing from the Health Direct website about how to take care of your mental health during COVID-19. And it's stuff that sounds very self-evident, but it's stuff that we need to remind people about. And it's stuff, particularly those in Sydney at the moment, really need to be understanding. So I think tackling the upstream is important. I think it's particularly important when you're looking at the young people going through this pandemic. As I said, empowering individuals to take a proactive approach. I think it's also, though, helping with social connectedness, helping to create that sense of community again. And I think this is an area of somewhere like the residential communities within ANU has a really big part to play as well. I think it's also to understand, it helps to understand the context and the different way I think young people are looking at what they're going through than us old people like me. Because I look at my life and I go, well, there have been things that happened in my life, and this is a couple of years in my life. And I know that it'll be better, and I can see that life will go, hopefully not completely back to normal. I hope we can learn some lessons, but I'll get there. But if you're 16, 17 years old and you look at it, this is a big chunk of your life. And it's a big chunk. And at the moment, you could be feeling, I don't know if it's ever going to go back to normal. What does that look like? And I think it's important to understand that there is a different way. Having spoken to some younger people, there's a very different way. And a lot of them are very impatient too, to get back to that normal life. And I think that's sort of talking through that patience and giving them that hope, I think is really important as well. And kindness, there's been, that's the New Zealand sort of key to COVID is kindness. It comes out in all the press conferences, and it's just a wonderful thing to hear, kindness and understanding. I've been in meetings with people in the last few weeks even where they've just erupted and stormed out of the office. And it's about, it's actually not their normal behaviour, but they are not actually, it's part of the pandemic fatigue and burnout. So I think it's understanding everybody's going through this in a different way, and we need to be non-judgmental and kind in that as well. But what I really want to talk about most of all is what I think is a discussion that we can have with people, is to understand the difference between going through times that don't meet your expectations and are a bit hard versus trauma. I've got a niece in Melbourne who's been through, of course, a lot of lockdowns. She's in her late 20s. And at Christmas time, when I caught up with the family, she said she had PTSD from lockdowns. Now, I didn't question that, but I do question that because, I just think PTSD has almost become, we went from a stage where it was stigmatized to have PTSD to almost like that's the thing to have. And this is particularly evident in the military. And I'm not saying that people don't get PTSD, they do. But that label gets put on a lot of things that aren't necessarily PTSD. Things like grief. If you've lost your buddy in combat, you actually may be grieving, it may not be PTSD. Things like moral injury, which is a whole other topic for another time. But it could just be that it's just that, you know, you've taken a licking, but you keep on kicking. It could just be that you need to move through this time. It doesn't necessarily mean that you've got a psychological disorder. And I think actually, if you take the glass half full look at things, you can use these bad times, because I don't think you can become resilient unless you have had bad times. I don't think you can naturally be resilient. I think it's about how you go through a hard time and come through it that actually builds resilience and actually gives an opportunity to growth. So I just wanted to go through a little of my own experiences about how I became resilient. And I do apologise here that if some of these stories, I forget how other people see the stories of my life that I just talk about these days. So I do apologise if this is upsetting to anybody. But I just wanted to give some examples of what helped me go through bad times and come out the other end to be a better person than I was when I went in. And the first one is my peacekeeping time in Rwanda in 1995. Now, Rwanda, of course, had just gone through a terrible genocide. We went over there about 6 months after that, or probably a bit longer than that. And it was a really, really tough deployment. We saw lots of, you know, kids being injured. There was the Pulau internally displaced persons camp. Some of my colleagues witnessed a massacre there where thousands of people died. That's me down there at the camp a little bit a week or so later, standing in front of a mass grave. But for me, the hardest thing was, and sorry to all the chaplains in the audience, is playing God. In other words, I had to, because we were working, we had a military hospital in a country that didn't have a really strong health infrastructure. There was only so much we could do. And sometimes we had to let people die, which is not what we do in the West. So this little girl, Savarina, she was about 2 years old. She actually had measles, so an infectious disease. She had measles encephalitis, which means she had brain damage. And we also, at the time, were caring for people who had been down at Cabejo. So our ICU was full, and we also had limited oxygen supplies because the UN had brought in a truckload of journalists to cover the massacre and offloaded our oxygen bottles, which is difficult, you know. But anyway, this little girl we had to let die. And so those sort of traumatic experiences were really hard to deal with. For me, I made the decision, I was reasonably comfortable with it. I could do a very step back, very pragmatic approach. Talking through the medics who had never, our medics are not nurses, they'd never had patients die before we were in Rwanda. Talking them through was really difficult. So my job became counselling, you know, the medics and helping them process it. And that was, you know, very taxing and everything else. But what I was hoping for was this little girl was an orphan who was at the orphanage run by Sisters of Charity, Mother Teresa's order, for those who don't know. And these sisters were just the best people I've ever met. They were just wonderful. They always had the right answer. I'd say to them, sister, who funds you? How do you get, you know, your supplies and things? And they'd say, divine providence. Whenever we want something, God provides. If we needed people to give healthcare, you came along, your divine providence. And they always had this great answer to everything. So I'm, you know, sort of counselling everybody. The nuns coming up the corridor, I'm thinking, oh, here's my chance to get the right words and to feel it. And I told the nun and she burst into tears. And I thought, this is not my day. This is really not my day. So, but it was a really hard time. And a lot of people I went over with, for, you know, those who are in the massacre and just those who are in this very difficult environment, developed PTSD, a very large rate of PTSD from both contingents that went from Rwanda. But I didn't. And I wondered why. And I think back and I look at a few key things about why I didn't develop PTSD. And I'm not saying that it wasn't difficult coming home, My friend who I was sharing a house with called me the couch potato because I wouldn't go out with him and do all this other stuff. But I think what really helped me was finding a sense of purpose. And my motto in Rwanda, and it's actually written on that on my door to my room there, which is, we're here to help and we're doing a good job. Just keep saying that mantra over and over again. This is why we're here. That has stood with me, and I look back now at Rwanda and go, Rwanda's a successful country. You know, that we did that. We helped them when they needed us most. Whereas others of my colleagues go, well, we went over there, we don't know why we went, and it was just a waste of a time and all it did to damage us. It's a very different outlook on life, and I think that helped a lot. The other thing that helped me was what I call, being a doctor, letting the pus out. And this is talking about things. And this is, again, bread and butter for a lot of people here. I think that that was probably the biggest thing for me. When I got back, a couple of weeks after I got back, I went back to work, and I had people at my health centre that I was running say, oh, I hope you had a nice holiday in Africa. We've been really working hard, since you've been away. Now it's your turn. Okay. But the commanding officer of the fighter squadron that I was affiliated with said, I want you to come and brief my guys and tell them what you went through. And he introduced me and said, you guys think you're the sharp end of the Air Force, but here's the doc. She's just been to the sharp end and she's going to talk to you about it. And that was my first opportunity to start talking about it, and one, get validation from these fighter guys who thought they were the best, to say, oh shit, doc. Some of them had to walk out of the presentation. It's a bit graphic. But it was also the chance to start processing it and putting it into context and letting the pus out so that I could actually get back to a healthier state. Then about 4 years later, I went to an F111 accident. And in this particular accident, this was again a very difficult time. I knew both of the guys who died in this accident. I knew their wives. It's a small Air Force at times. And these two had ploughed into this island. And so part of my job as the doctor in charge of accident investigation was retrieving the bodies. We spent all day on the first one. It was hot, humid. We were in mud, all of this sort of stuff. And I got back to the ship that night. We were living on a Navy ship. And I had nightmares that night that I was back in Rwanda. I actually was chopping off limbs, and it was just this horrific nightmare. And the next morning I got up and I was physically ill, and I thought, my body was saying, don't go out there. But I had to. I had a strong sense of purpose. I had to get these bodies out, get them back home to their loved ones so that they could, bury them, etc. But what I realised, so we did that and it all went really well. But what I realised was my next lesson was that I still had unresolved things about going through Rwanda. So what I did, not only did I get help for all in fact, yeah, it was all guys and me. That's pretty typical in the military. I made sure all of the guys that I was with got followed up by with mental health support, and I went to see a psychologist myself. And I basically, again, let the pus out. Again, I got some support. It was only a couple of sessions that I needed to go to, but that was the third lesson. Knowing when you need help. Knowing when you need help and getting that help is actually a sign of resilience. A lot of people think that's a sign of weakness. There's still a lot of cultural bias towards that, but it's actually a sign of strength. And this is a sign of me becoming more resilient and growing through the experience. And then a few years after that, and that little girl Severina died in April. The F111 accident was April. This was also in April. So leading up to Anzac Day, I've got a lot of thoughts on my mind normally. But this is the Shark 02 helicopter accident in Nias. This is where 9 of our service people died. 3 of them were my people that I had sent over there to do this. And it was a very traumatic time for all of us in the health services. But because I had gone through what I'd been through, I was able to focus on what was most important, look after myself, but look after my team. And so the fourth lesson was being able to reflect back on what you've been through. A quote from Walt Disney there, you may not realise it, but a kick in the teeth may be the best thing in the world for you. But really, what I kept thinking is, I've been through worse than this. I can get through this, but I need to help the other people get through it as well. So they were the lessons that that I learned and that helped me on that journey. And so now when I reflect and I realise that when you talk about resilience, it's not a binary concept. I like to think of it as a battery that needs charging. Other people talk about a bucket of resilience that needs topping up. But I like to think it's a battery. And I think that, you know, the important thing is to stay charged, to get to that point where you have a sense of purpose, you've got the strong will, you feel you're healthy of body and mind. But then understand when you get down, when your battery runs a bit lower, you do need to talk about it. You do need to process it and talk to somebody about it. And you'll get to a point, hopefully before you've completely read, where you actually need more help, as you were saying before. You actually need professional help to help you through it. And admitting that and understanding that and reaching out for that help is a really important lesson to be learned. And I think more people need to understand it. But then also, you need to then think back on what you've been through, learn those lessons to actually then prepare you, get your battery topped up, get yourself healthy so you can go through things again and keep sort of titrating where you are on that thing. So as I said, that's the lesson I've learned. But I think not only does that mean I've become resilient, but I also like to think that I wouldn't have got to where I got to, which was Surgeon General of the ADF before I left, unless I had been through those experiences. So while I don't wish that those people died and all that terrible thing happened, I wouldn't be who I am without having got that. And this is a concept that's been labelled now post-traumatic growth. And, you know, that not only have I bounced back and got the battery charged, but I've supercharged it. So I've actually been able to grow from those experiences. And, you know, that old adage, you know, what doesn't kill you makes you stronger, can actually be true. And I think the most important thing is, though, just because you have bad times or trauma does not mean you're going to end up with a mental health illness and PTSD. And I think that's a really important lesson to be learned. And I think that's a lesson we need to talk with people more about. The fact that out of this pandemic, the silver lining could be that we have a more resilient people, communities, and nation, or world even, if we actually get the lessons right and do a better job. So just finishing off then, what are the lessons then for carers? I think those of us in the caring profession, sometimes are always projecting out, but we also have to look after ourselves. So looking after yourselves, cultivating our own resilience and knowing our limits and knowing when we have to get help are really important in this as well. I think encouraging, don't dismiss the small things, the community spirit, the activities that go on here in Burgmann and other colleges, creating that sense of connectedness. That is a really good buffer. It really helps the battery stay charged, and it also means there's more support around if you do need help. I think it's important to understand that the young people are viewing this pandemic very differently to how some of us others are, and not only young people, different groups, different vulnerable groups, etc. It's had a much bigger impact on some than others. I think also it's important to sort of think about that grieving piece and help people from that context as well, and encourage patience. I haven't had much patience lately, as Pat, who works for me, will tell you, but even I'm getting pandemic fatigued at the moment, but being patient and understanding that we're going to get out of this. We can talk all we want about what vaccine and everything else. There's heaps of vaccine on its way. We will get through this. We will come out to a better day. The other thing I think is important, and you guys will know this, is don't judge. It's really easy to judge people based on your experience. You know, why aren't they coping? We see there's some people, most people here are dealing with life and expecting the lockdown any day, as we all are. There are some people, though, that even when there were no outbreaks, still didn't want to come on do face-to-face teaching and come on because they're so worried about COVID. And then there are others who, new students who are down to moose heads the first opportunity they could get in the middle of a pandemic. So it's a really broad range of things, and I think we need to understand that everybody's experiencing this differently. And I think a lesson for me, don't fight the unbelievers. There is a core of people here who don't believe in the pandemic, supposedly. They've been infected by some of the stuff that's going on overseas. They're anti-vaxxers, all of that sort of stuff. No point worrying about them. that Darwinism will come in, or the grace of God or something else. That's you to control what you can control. I really think that that's the most important thing. My partner and I were down at the snow a few weeks ago, and we went up on the ski train up to Perisher. And we're supposed to all be wearing masks because we're in regional New South Wales. She said, that person's got it under their nose. And that's supposed to... I said, chill, wear your mask properly. Just don't worry about everybody else. And I think that's really important as well, because it can get frustrating. And of course, the ultimate sign of caring in the pandemic, be COVID safe and get a jab. That's the way we demonstrate care to the nth degree in the current world we're living in. So thank you very much, and yeah, happy to take any questions at all.